This YouTube video is going to get demonetized, so thank you to those of you who support me on Patreon. What does Trump, RFK Jr, Andrew Wakefield and Dr. Weldon M.D have in common? They've all said that autism is a disease, comparing autism to an epidemic caused by an ingredient found in the past in childhood vaccinations. And three of them are going to have a lot of power over the next 4 years, not just in the United States, but influence across the world. Hey friends, I'm Mike, a late identified autistic adult, and today we're diving into the tangled web of misinformation surrounding autism, vaccines, and public health. At the heart of it is this guy, RFK Jr, hand-picked by Trump for a top role in public health.
Well, I do believe that autism does come from vaccines.
Who has built his career on stoking fear about vaccines, 5G, and the similar set of beliefs that I touched on in my earlier video, the one where I did the debunking about the autism reversal twin study, in which 2 young children were subjected to a 3-course meal of intensive ABA, numerous pseudoscientific treatments, and bogus lab and supplement interventions, and topping it all off with strong links to several organisations involved in selling products and services to the hapless parents of autistic children. Not only that, but the organisation behind that bogus paper uses that paper to market itself. That's all that science is to these folks, a marketing tool. Let's start with Trump's pick to head the CDC. A former practicing physician turned politician, Dave Weldon M.D. Whilst he isn't an anti-vaccine activist like RFK Jr or Wakefield, his comments in 2004 linking Thimerosal, a preservative in multi-dose vaccines, to autism shows a lack of understanding of autism research. In June of 2004, he makes some lengthy comments referring to autism as a disease, it's not, and an epidemic, it isn't, but I will clarify later in the video. Weldon starts with, I would like to take this time to address what I consider to be a very growing problem, the epidemic of autism and neurodevelopmental disorders that are plaguing our nation. In January of this year, the Department of Health and Human Services sent out an autism alarm. An autism alarm. Was it like a late Christmas present? Did it come in the post? An autism alarm to the nation's paediatricians. In this alarm, they stated that 1 in every 167 children is being diagnosed with an autism spectrum disorder. He goes on to say, the number one question has been whether neurologic problems were caused in some children by the high levels of a mercury-containing additive that was included in our vaccines in the 1990s. This mercury-containing additive is called Thimerosal, and in the 1990s, infants and unborn children were exposed to significant amounts of mercury at a most critical point in their development. He summarises with, as I stated in the outset of my comments in this afternoon, autism was once in America a rare and infrequently seen condition. I went through 4 years of medical school, internship, residency, and years of private practice and practice within the military, and have not seen one single case. I have seen case after case in my congressional district over the last 7 years, a disease I had never seen before. This guy will be heading out the CDC. Now, autism is not a disease, it's a neurodevelopmental condition, it's a different neurotype, and there is no epidemic. It's not like saying I've been diagnosed with terminal autism, which is in some ways true. I have been formally diagnosed and my condition is as lifelong as I am. Autism is a complex spectrum condition. There is no one single cause. Autism does have a strong genetic component, but we don't call it an STD. Calling autism a disease, it's not, or an epidemic, it's not that either, is being overly simplistic. The first person to be diagnosed formally with an autism spectrum condition was Donald Triplett in 1943, and he sadly died only last year. It's literally impossible to have met a diagnosed autistic person before then. Autism existed, but we didn't have a label for it. My late adult autism diagnosis at the age of 42 would put one data point in the charts for, oh no, another autism, it's on the rise. Except I've always been autistic. But not according to the public health datasets, I wasn't. Hopefully that makes sense. Let me know in the comment section below. We've all seen mercury before, the liquid metal at room temperature, usually in the form of a little silvery glass blob in the base of a mercury thermometer. If you're over 35, you might even have seen these at school, or possibly even played the little mercury blob from a broken thermometer. Mercury thermometers were everywhere. In fact, some places in the world still use millimetre of mercury as a unit of pressure. That's because when mercury is heated, it expands in a consistent, linear way. Thimerosal contains mercury, about half per weight, but it isn't actually mercury itself. It's an organic compound that contains it. It's an incredibly potent antiseptic, and it's been studied extensively. And that's because it's in a lot of great many things. It's in a lot of stuff. It's in creams and ointments and sprays and eye drops and contact lens solutions. It's also in some multi-dose vials of vaccines. It means a vial containing multiple doses can be produced safely, making it cheaper. There's no evidence that thimerosal causes autism. In fact, autism diagnostic rates have been increasing, despite thimerosal being phased out from most US and European multi-dose vaccines. In the United States, this phasing out took place in 2001, 3 years before Dave Weldon M.D.'s comments about the autism disease epidemic being caused by it. In 1999, the FDA reviews the use of thimerosal in childhood vaccines and found no evidence of harm, but as a precautionary measure, recommended its removal from the routine vaccination schedule. The American Academy of Pediatrics and the Public Health Service issue a joint statement that says, "There is no data or evidence of any harm caused by the level of exposure that some children may have encountered in following the existing immunisation schedule." In 2000 and 2001, the Immunisation Safety Review Committee issued a report concluding that there is not enough evidence to disprove claims that thimerosal in childhood vaccines causes autism, ADHD, or speech or language delay. Other than some redness or swelling at the injection site, a risk assessment showed no other risks. In 2003, 2 studies looking for a link found none, and the final children's vaccines that had used thimerosal previously expired. In 2004, a meta-analysis was conducted, reviewing over 200 studies, and concludes that the studies consistently provided evidence of no association between thimerosal-containing vaccines and autism. In fact, by the time Weldon made his comments in 2004, thimerosal was already gone. It was removed from most childhood vaccines in the US and Europe. This is Editing Mike. Just a quick note to say that the measles, mumps and rubella MMR vaccines do not and never did contain thimerosal. That's a bit of a mic drop moment, I have to say. Studies conducted before and after its removal consistently found no evidence of harm. Yet, anti-vaccine activists continue to focus on it, fueling unnecessary fear. The line that anti-vaxxers push about the CDC and FDA not wanting any more research into mercury causing autism, there is kind of a basis in truth there, in the same way that it's been done to death already, lads. We've got other priorities now. But why are we here now, in 2024, still so obsessed with vaccinations causing autism? It stems from Andrew Wakefield, the man whose fraudulent study falsely linking the MMR vaccine to autism kick-started the modern anti-vaccine movement. Wakefield lost his medical licence, but his influence lives on. Very briefly, to recap, a British trial lawyer in the 90s wanted to find evidence of vaccine harms so that he could sue the vaccine manufacturers and make
This is a journey into money.
Loads of money. Over $500,000 or £435,000 was procured from the Legal Aid Fund. This is a fund intended to support the legal costs of those who cannot afford to pay for a private lawyer, and this money was used by Wakefield to fund his research.
Loads of money.
His paper, later deemed fraudulent, attempted to link MMR to autism. It used 12 cases, and every single one was falsified as, quote, "Not one of the 12 cases reported was free of misrepresentation or undisclosed alteration." The original paper was published in The Lancet in 1998, but it took 12 years before it was properly retracted. The co-authors of the paper must have been naive or complicit, and 2 of them did not indicate that they wanted to retract the paper. Measles, once eradicated in the UK, returned. But Andrew Wakefield losing his licence and having the infamy of the worst science scandal of modern times, that didn't stop him. He left the UK and found somewhere else where his views are welcomed. The United States of America.
Discredited in Britain, Andrew Wakefield has reinvented himself, and now he claims to have the ear of the president.
Papers like Wakefield's and the culture that they spawned cause murky waters, particularly for scientifically illiterate parents. Who are they going to believe? I mean, we all once were scientifically illiterate, right? Can't blame them too much. Wakefield has since partnered with groups like Autism 1 to promote dangerous and unproven autism treatments, capitalising again on fear and misinformation. And his influence paved the way for figures like RFK Jr, who continues to spread these harmful ideas. He established in Austin, Texas, to practice his ideas of autism therapies on children, and was paid $400,000 by that organisation in 2005. He also set up a charity called Strategic Autism Initiative to seek donations and income from others to fund autism research, and took $317,000 from that too. He's currently the Director of Medical Interventions for Autism, MIA, that sounds really onerous, and the Autism Media Channel.
4 years ago, he came up with the controversial idea of making the treatment of autistic children into a reality TV series. He pitched it to some of America's biggest cable networks.
In fact, Andrew Wakefield is in good company. Here he is on the Alex Jones InfoWars podcast.
There is undoubtedly a connection between these vaccines in some way and neurodevelopmental regression into diseases such as autism.
And that was in 2011. He should know better. Andrew Wakefield is also involved with, like I say, Autism One, whose slogan, "Make our children healthy again," or, I don't know, mocha, reminds me of something. Andrew Wakefield has been a keynote speaker at this conference, spreading the usual nonsense about autism. And do you remember Dave Weldon from earlier in the video? Well, here he is at the Autism One conference, receiving an award from this chap, who was also part of Andrew Wakefield's Thoughtful House Clinic. He was there at the opening, and I found this PR statement online which reads, Dr. Arthur Krigsman claims to have been able to independently confirm Dr. Wakefield's original findings. Really? Maybe in his dreams, his fevered imagination perhaps? But on this occasion, do think of the children, the young autistic kids who get sent to clinics like Thoughtful House, or whose misguided parents attend or support organisations like Autism One. Anyway, do you know who else is involved in Autism One and has keynoted several of their conferences? RFK Jr. Donald Trump tweeted, I didn't tweet actually, what's this called, a truth. Donald Trump truthed. I suppose it is true, because he probably is thrilled to announce Robert F. Kennedy as the United States Secretary of Health and Human Services. Now this would make RFK Jr. the boss of Dave Weldon at the CDC and reporting to Trump directly. Now RFK Jr. has been steadfast in his beliefs. This clip is from 2005 where he talked to Joe Scarborough on MSNBC, where he says,
"My son, born in 1991, has a slight form of autism called Asperger's. The generation something happened in 1989. Exactly. What happened was the vaccine schedule was increased. We went up from receiving about 10 vaccines in our generation to these kids receive 24 vaccines. Today, 1 in every 166 children have autism, and plus 1 in 6 children have other kinds of learning disorders, other kinds of neurological disorders, speech delay, language disorders, ADD, hyperactivity, that all seem to be connected, that are all connected, the science shows are all connected to autism."
He's also recently, just a few months ago, stated that he plans to create, in lieu of prisons, a sort of organic labour camp, and not just for those going cold turkey from illegal drugs, but also ADHD medication. He's going to put these new organic labour farms in rural America. Anyway, this is what he said.
And I'm going to create these wellness farms where they can go to get off of illegal drugs, off of opiates, but also legal drugs, off of psychiatric drugs if they want to get off of SSRIs, to get off of benzos, to get off of Adderall, and to spend time, as much time as they need, 3 or 4 years if they need it, to learn to get reparented, to reconnect with communities, to understand how to talk to people.
Because as we all know, forcing someone with a neurodevelopmental condition to work on an organic farm is definitely the best way to cure them. Maybe they can grow some magic beans while they're at it. Trump himself has made questionable statements about vaccines causing autism, and even though most of the world knows that's just Trump and just disregards his claims, by appointing RFK Jr. to lead the HHS, Trump has taken this rhetoric from fringe circles to the highest levels of government. The HHS sets healthcare policy in conjunction with the CDC. And it's not just autism. RFK Jr. also argued that a herbicide causes gender dysphoria and that drug use, not HIV, causes AIDS. And that the 2019 coronavirus was a bioweapon that spared Chinese people and Jews. Oh, and the vaccination healthcare records were somehow akin to Anne Frank's diary. You know, it said you can't make it up. You know what I mean? You can't make it up. But in RFK Jr.'s, Trump's, Dave Weldon M.D.'s and Andrew Wakefield and the rest, I think it's shown now that you can just make things up, especially when there's a clear profit motive to do so.
Loads of money.
So why are autism rates rising? It's not because of vaccines or Thimerosal or some mysterious epidemic. It's because we are better at recognising and diagnosing autism across more demographics than just the traditional middle-class young white boy. Girls and women are starting to be noticed as the generally higher maskers that they are, and diagnostic criteria have evolved to recognise a broader autism spectrum. Healthcare providers have better information and are more equipped to identify and support autistic people. We have a long way to go, but the rising rates are rising rates of diagnosis, not rising rates of the causes of autism. Autistic people were always there. We just weren't identifying them before. We're on an S-curve currently, and I think that the rate of autism diagnosis will eventually plateau and level out once equitable access to assessment and diagnostic processes and better support is there. What do the next 4 years bring? Well, we've already had 4 years. In the UK Channel 4's Dispatches programme, they erased this back in 2017, near the start of the first Trump term. And not much happened as a result. I mean, regarding autism, other than measles outbreaks in the United States, where around half of those contracting measles who were unvaccinated required hospitalisation, and sadly most of those were children. Collateral damage, I suppose, and entirely preventable. I'm trying to stay on topic here, so now in 2024 we're facing the very real possibility of having someone who actively promotes these dangerous myths in charge of the United States' health policy. And this all started with a UK ambulance chasing lawyer looking for a quick buck. But it's now at the point where the consequence of a little greed has two powerful but misguided men who will be running healthcare for the next 4 years. And this isn't just about debunking old theories anymore, it's about protecting the healthcare system from being guided by conspiracy theories rather than science. The stakes have never been higher, and the need to stand up for evidence-based medicine has never been more urgent. But for perspective, the United States healthcare services have been here before. In the last Trump term, we had a CDC leader who promoted pseudoscientific anti-aging treatments to patients. And so, in some ways, Dave Weldon M.D. could be seen as an improvement. Some people have been quite upset at the thought of a second Trump term, but it might just be helpful to reframe it as a final term, right, rather than the second one. I mean, who knows? I'm just doing the debunking here, not the politics. So do vaccines cause autism? No. But several people are getting rich trying to convince you otherwise. And if you like my debunking style, then you're really going to love my earlier videos on this topic. I've made a playlist and it's here at the end of this video and in the description below. Thank you to my patrons who not only make videos like this possible, I have 3 tiers and you are all appreciated very, very much. Access to the lovely folks on our Discord community is included on the lowest tier at just $4 a month. And we have exclusive live streams, video content, and you get behind the scenes content too, so to speak, at the various levels. And if there ever was an Autism VIP card, it's got to be this one. But if you can't join the Patreon and still want to support me, giving the video your best like button press, stimming the subscribe button, pressing the bell, and sharing the video to other places like forums and social media helps me a ton too. So thank you so much. See you soon. Bye.